Even in medicine, the thinking around cannabis is pretty divided. Sometimes it feels like it's just based off vibes. Well, enough vibe medicine. We're going to go over what the evidence really says about cannabis and rank how certain we are about each claim. Does it cause schizophrenia? Does it actually help with sleep, or anxiety, or pain? Does it shrink your brain? We'll cover it all in this video, starting with the piece of high certainty evidence. These are findings confirmed by multiple strong randomized controlled trials, basically the medical version of on God. First off, does THC cause acute psychotic symptoms? Unfortunately, yes, and this is with high certainty. In controlled experiments where healthy volunteers with no psychiatric history were given pure IV THC, nearly half the participants developed psychotic symptoms, including paranoia, hallucinations, disorganized thoughts, symptoms resembling schizophrenia. Thankfully, these symptoms were temporary, just lasting hours. Schizophrenia is defined as having these symptoms for at least 6 months. So, does THC increase schizophrenia risk? Yes, but with a disclaimer. But first, let's explain moderate certainty. The evidence is solid. New studies might refine the numbers a bit. Basically, the medical version of low-key for real. And one reason is we can't gather thousands of people, randomize them, make them smoke weed for 10 years, and see if they get schizophrenia or not. That'd be insane. We live in a society. But we can look backwards on a large scale. And a review of over 66,000 people shows schizophrenia risk goes up with use. Yearly and monthly users, no significant risk increase. But daily use nearly doubles the risk of getting schizophrenia, and daily high-potency use nearly 5 times the risk. Researchers in Denmark tracked nearly 7 million people, nearly 50 years, and they found that people with cannabis use disorder, basically addiction, were 2 to 4 times more likely to develop schizophrenia. And the stats are even worse for young men. Up to 20% of schizophrenia cases could be avoided if they did not use cannabis. Thankfully, most cannabis users don't develop schizophrenia because it requires a genetic predisposition to it. But for those who do have that vulnerability, yes, cannabis appears to be a trigger. The takeaway is, if you have a personal or family history of psychosis, schizophrenia, or bipolar disorder, or if your brain is developing, you should avoid use. But what about anxiety?
Does cannabis help with anxiety?
Cannabis makes you high, which is the opposite of anxiety, right? Let's take a look at what we know for certain first. What are the side effects of being high? Well, Seth Rogen could have told you about this one. The common effects of cannabis are euphoria, dizziness, drowsiness, memory loss, difficulty concentrating, blurred vision, memory loss, and anxiety, especially high-dose THC. There's strong evidence that high THC actually makes anxiety worse. That's why the same person can feel relaxed after one hit, but paranoid after several. There's a chance low-dose CBD might help, but first, a PSA.
Never drive high now.
Okay, not THC, but does CBD help with anxiety?
My mind on the data and the data on my mind.
Yes, well, it's a very low certainty yes. Forget taking it with a grain of salt. Take it with a whole Himalayan salt lamp. Low certainty is like the medical version of it might be, but it might be Delulu. A 2024 study found a large effect that CBD reduced anxiety. But the studies were tiny. They were short trials, as short as only 110 minutes. They lumped together different conditions, generalized anxiety, social anxiety, PTSD, OCD. Dosing was all over the place. And then a recent systematic review just last year, out of 13 of the best studies, 70% of them showed positive results, 30% of them showed negative results. So there's conflicting data. The signal is there, but we genuinely need more research. I hope stronger evidence emerges supporting CBD for anxiety. If it does, I'll update all 7 of you immediately. But based on what we have right now, I'd advise caution. So does cannabis help with anything? Yes, CBD and THC are actual medicines. CBD is used for rare drug-resistant pediatric epilepsies. THC is used for appetite stimulation for AIDS patients, and it can be used to help reduce vomiting in chemotherapy patients. And there's really solid evidence it works for chronic pain. This is great news for the 1 in 6 people who live with chronic pain and have tried everything. In the analysis with over 5,000 patients, we found some patients achieved meaningful relief, but on average, the improvement was only about half a point on a 10-point scale. So unfortunately, not much. And something to consider is people in chronic pain tend to be older adults. And we know with moderate certainty that THC increases side effects in older adults. is significantly increased dizziness, drowsiness, and withdrawals compared to non-users. There was no increase in serious adverse events, nothing life-threatening. But dizziness in an older adult can increase fall risk. There's one more at-risk population. Can you guess who it is? Pregnant women. Prenatal cannabis use is linked to adverse birth outcomes. This review, with over 20 million pregnancies, found cannabis use in the mother is associated with low birth weight, preterm birth, small for gestational age, and probably increased perinatal mortality. We can't test on pregnant ladies, obviously, but we know with good enough certainty that it's important to avoid use during pregnancy. Now here's a big one. Does it shrink your brain? Does it lower IQ? This famous 2022 study in New Zealand followed over 1,000 people from birth to age 45, tested their IQs repeatedly over decades. The findings showed about a 5-point IQ decline and smaller hippocampal volume on brain MRI on those who were heavy users. But significant limitations exist. First, the actual group of persistent heavy users was small, only about 20 to 30 out of the 1,000. Second, socioeconomic factors alone could explain these findings. Third, IQ difference was not seen in twin studies where one used cannabis and one didn't. And finally, new studies show cognitive effects reversed after a month of stopping cannabis use. So the answer for this one is maybe, but probably not. The moment we've all been waiting for. Does cannabis help with sleep? Yes and no. People swear by it, and we can actually say with certainty that it improves their subjective sleep. But when you actually measure their sleep stages, there's no consistent improvement, and chronic daily users actually show worse sleep, more time awake at night, less efficient sleep, more light sleep. It does make you fall asleep faster though in the short term, and it looks like THC-containing products show better effect than CBD. Here's my concern. With chronic use, tolerance develops. The more you take, the more you need, and the harder you withdraw. Insomnia is one of the most common symptoms of cannabis withdrawal. You can have insomnia for weeks after stopping cannabis. So just like caffeine withdrawal headaches, it might just be treating something caused by the drug in the first place. Bottom line, I think it's fair to say there's a small signal for short-term benefit. We know it helps a little bit with pain, and being less in pain by itself can help with sleep, but there's no evidence for long-term use, and professional guidelines like the World Sleep Society recommend against it. From a safety standpoint, cannabis makes little sense as a Schedule I drug, next to heroin, but it's not harmless, so it's important to know what specific populations are at higher risk. So if you choose to use, be mindful of the frequency, the dosing, and the potency. Avoid use during adolescence and pregnancy, and never drive high. That's evidence-based medicine, not vibes.
Sweating is an example of homeostasis.